Hello YouTubers. I'm doing this video today to explain the liver hemangioma surgery that I had. Let me start from the beginning. Around March of this year, I went for my physical, my regular physical, because you know how ladies, we always do our GYN physicals every year, but the regular physical, I kind of skipped that for some years. I finally went in March. The doctor noticed that my liver was enlarged. So from there, he sent me to get an MRI scan. That came back with a mass on my liver. So from there, I had to get a CT scan to find out if it was cancerous or what kind of mass or tumor that it was. And that came back that it was a hemangioma, which is basically a collection of blood clots, blood vessels accumulating and clumped up on my liver. He said it was about 19 centimeters and weighs about 8 to 10 pounds. So from there, I had to schedule my surgery. I had my surgery on September 2nd at Inova Fairfax in Virginia. It's a really good hospital. Dr. Shaver and his team did the procedure. Initially, the procedure was supposed to have taken 3 hours, but I guess once they actually started the process, they seen that the mass or tumor had actually wrapped around the whole right lobe of my liver. So I ended up getting my the right lobe of my liver completely taken out, including my gallbladder. Recovery. That was a process and still is a process. Today is September the 15th, so it's about 13 days later. Today is the first day I'm able to actually stand up, straight up, without bending over and with a minimal amount of pain. When I left the hospital, I was using Oxycontin and Tylenol, extra strength. So the first couple nights home was terrible. Let me go back to in the hospital. The first night after surgery was horrible. Of course, I was on the morphine drip. I was able to have some relief with that. But as they started to wean me off, I was on some kind of pain medicine through the needle and some other kind of medicines through the needle. But it was pretty good. I wasn't able to walk the first day at all. I probably did like one lap on the hospital floor because they make you get up and walk, and it was very painful. I was bent over like an old lady. Sleeping was horrible. I had to sleep sitting up. Then let me move back forward to when I came home. I was released on Tuesday. I can't remember the date. The Tuesday after that, Friday the 2nd. And I had the Oxycontin and the Tylenol. That didn't help at all. It was horrible. It was worse than having my kids. The pain, that is. I couldn't sleep, couldn't get comfortable. I switched between laying down, sitting up on a bed with propped up pillows, or sitting up in a chair with propped up pillows. And it was terrible for the first week. The pain medicine was not working. I called finally last Friday. I called the nurse, and she said I can start taking ibuprofen in addition to the Oxycontin and Tylenol. Well, that helped a lot. And finally, I started getting more sleep at night. That was Friday. Saturday was pretty good actually during the day. Sunday was pretty good during the day. I walked around, went to Walmart, did more walking, still hunched over, but not bent over, but hunched, and still very sore. And today went Thursday. Tuesday night, I was able to lay down on my back. I'm still not able to lay on my side. Last night I had to kind of prop myself up on a pillow on the side, but it was still very painful. And right now I'm completely off all the narcotics. That was as of Friday, and I'm just doing the ibuprofen, 800 milligrams, 800 to 1,000 milligrams, 3 times a day. And I'm going to show you the actual cutting, because the incision wasn't bad actually, and they sealed it up with some kind of glue, which is kind of new. To me, it's new. And it's healing pretty good, so I'll show you that in 1 second. So, trying to get a good view of the scar. It starts like on the left and goes around to the side. And I'm kind of pleased because I'm still, I have a lot of fluid and swollen, but overall it's pretty good. So next week I'm attempting to go back to work on Monday. I have a sit down job, so it should be fairly easy. I might get a pillow so it can be comfortable, because I'm sure it's gonna become sore the longer I sit. I have to get up and take some walking breaks too, but we'll see how it goes on Monday. I'll try to keep you all posted. If you have any questions about the liver hemangioma surgery, let me know. Hit me up. Thanks.